So, hello, good afternoon, everyone. And I'm going to start something very important. And before I start, how many of them really believe that the first or the firm hand grip or handshake still tells a lot about a person? That's great. So they say that even you can judge someone with their just handshake, whether it is firm, it is weak, or it is sometimes painfully strong. But I would here say that after going through these slides and the understanding of hand grip, that this hand grip or the handshake has been quietly evolving around us and giving more understanding towards the metabolic health since more than 2 centuries. Okay, and this is going to be my talk here, and I'm Dr. Ketan once again from Mumbai. And hand grip test, the fifth vital sign in the metabolic health, which I'm going to talk. And as Dr. Bansi Sabu sir has mentioned, we have to talk something more about. By that time, I can just give it to you. You can just try this because it would be more interesting then. So we will come to this again. Yeah. So you have to keep it on the right side in the this 90-degree and hold it. Yes. So we can compare and have three, readings, trials and understand. So it's 23.7, which is normal. So I'll come back to you also, ma'am. Of course, I'm not disclosing the age. Thanks. So the historical perspective here, if I have to say, let's take a back step here in the history. The concept of this testing grip strength isn't new. In fact, the very first dynamometer which is seen here on the picture was built back in 1798 by this French rifleman who has invented this. His name is Admi Rigner, and he was from the French, and it was patented in 1817 here. I'll come to those slides. But then it was used just as a strength testing machine for the soldiers and the worker, how much they are having the strength and their capability and the vulnerability of this physical strength. So it was used during that time. So as I was going further, I found out something more interesting about this device, and this was the first dynamometer which I found out, and there was something written in the French there which suggested that it is a Regner's dynamometer. It is from one of the suburbs of Paris. That is what written in the French, and this I am getting it from the National Museum of American History. And then going more further, a video which I found out, a very old dynamometer. This is how it has been looked here. We can just press, you get your results, and then you manually have to go back to the zero strength here. You know what's amazing, sir? Actually, I was not aware that they are giving this as a memento to everyone. I got it from Mumbai for everyone, just to show. And the best part, it is of the same companies here. So this was something in early 1970s. Then I went further. I got in late 1970s. This is how the hand grip test was seen. The machine was seen. And you can go to the zero. You can put the restart button on the front here. Then it goes to zero. So while going more into R&D, I found out something called as SR100 strength meter. This was used as a medical sport mechanical device in the Soviet Union of Ukraine. And then something came in 1980 similar to the 70s. Only the difference was they had a restart button, more accuracy from the behind side here. So if we have, so this was the evolution of the grip strengthening from 1908, where it got patented in 1817. In early 20s, we found out that it could be used in nutrition, occupation medicine, and later on, in today, when we are coming here, we saw this is how the digital dynamometer looks like here, and which we are talking as a fifth vital sign here. So any organizer's team is here. Dr. Sir has mentioned that we require 1 to 2 slides. I have mentioned 8 slides here. Yeah. Okay, but talking about this hand grip, why do we really need this? Do we really need this sign here? So what has changed? Actually, the traditional vital signs captures the immediate physiology of a person, but it doesn't reflect the functional resistance or resilience of that person. So in today's epidemic of your obesity, diabetes, sarcopenia, where we are trying to evaluate it, the missing link or the gap between of that physiology and the functional strength of the person which is trying to bridge the gap. So yes, evidence have shown that muscle strength is more important and more predictive for survival than just the muscle mass. So we see you go to the gym, you build up your body, your muscles are built up, but really that matters, really that bulk matters, or your quantity is mattering over the quality. This is what the test is talking about here. So for years we have evaluated that sarcopenia is with the bulk or muscle bulk which we have seen, but larger studies have come across from the EWGS, that is the European working group of on sarcopenia in older population. They have mentioned that muscle strength is the most reliable measure for the function, and the grip strength in particularly reflects the total body strength and the functional capacity of a person. So this is the European. There would be something in Asian also which I would coming across, and for these studies there are more striking findings which have taken place in the pure study across 17 countries, which are representing an inclusion of more than 1,40,000 participants, have mentioned every 5% decrease in the grip strength has given mortality increase by 16% here. And the most remarkable thing was the grip strength outperformed systolic blood pressure in predicting the cardiovascular deaths here. So independently of asking any other questions, this has been a remarkable notice which was done by these studies here. Now talking about something related to the diabetes, we all know that skeletal muscle is our largest site of glucose uptake. Weakness where the muscles are low, the less glucose uptake or disposal is happening, leading to more of insulin resistance. And here the multiple prospective studies, the cohort studies from Japan, say from Korea and the UK Biobank, have mentioned that the weak grip or the legs decline grip is independently increased in the HbA1c of the person. So decline of the muscle mass is proportionate to the sugar levels what you are going to occur. In fact, this decline appears even before your sugar are deranged on the lab reports. So this is showing us which could be the early sign detector of a person. Talking about something related to metabolic syndrome here, a 2019 meta-analysis has confirmed that the grip strength is inversely related to the metabolic syndrome's prevalence. And importantly, this effect persists even after adjusting to the BMI. So BMI was an independent factor, but this is a vital role in majorly South Asian population where BMI is underestimated risk factor, where the grip strength captures the vulnerability and accuracy of this hand grip test. Now related to the cardiovascular complications, grip strength is not only predicting who will develop hypertension, okay, who will get hypertension, who will get medicines on this, but also it is telling which of our cardiac patients are going to get hospitalized, and if they are hospitalized, how long they are going to stay in the hospital and how many times they would be readmitted where the risk is highest for these cardiac patients. So we see there is a strong association here, and we can integrate independently in spite of asking our traditional questions to the patient, whether your BMI is high, whether you are smoking, whether you are doing any cardiac activities, your fit principles according to your resistance training. In spite of all those activities, what we traditionally ask, this has come out to be a better predictor for the cardiovascular implications as well. And the beauty of this vital sign, what I'm talking about, that this is actually used practically, because as we saw, it took less than even 30 seconds. We have mentioned 2 minutes though, but 30 seconds or 2 minutes, because we take an average of 2 readings to 3 readings, whichever is the best on the right hand, on the left hand, I will come to that. So it has been used in the outpatient department here. They have a clear cut-off values. If we see about the European guidelines, it is less than 27 kgs for the men, and for the women it's 16, and talking about the Asian group, it's 28 and 18 for the female respectively. So it could be used in our daily practice, in our OPDs, the patients who are walking in. It could be very simple, it doesn't require any major investment also, and it can be screened for elderly care assessment for the people. Just like what we do the blood pressure, we can just do this test as well. So we have 4 vital signs. We see TPR blood pressures, TPR BP. Here could be the 5th one because it doesn't require any interventions apart from just gripping and testing the test. So this is the beauty of this. And traditional markers where we talk about HbA1c, we talk about the blood pressures, we talk about the BMI. This often see late changes in the diseases, in the trajectory or the the evolution of those diseases. It comes much later into the lab reports, whereas the grip strength is weakened or it declines much earlier before the functional warning sign, as a functional warning sign. So it is non-invasive because it is consumable free, it is scalable and ideal for preventive screening for the patient as well. So dear friends, we know that we have gone through the COVID and we were checking our oxygen levels. SpO2 was one of the new vital sign in the respiratory medicines. But now it's the time that this hand grip test or the strength, what we are talking about, should deserve its recognition as a new tool in the metabolic medicine. Okay, so because again, it can be used very routinely, it is low cost tool, but a very powerful tool which is giving more insights about metabolic health. It can be used even in the standard practice as I mentioned, and we have to inculcate in our own policies rather than going on the big scale and coming and waiting for the policy change. We can incorporate this same thing in our own clinic and change the protocols of these patients. Where they are coming, we can adopt it and we can see the change here. So that's why I have been doing this since more than 10 to 11 months in my own clinic, and we had a very patient of 42-year-old who had come with a normal BMI, of course 25.3, who was a typical thin fat Indian phenotype, whose HbA1c was borderline of 5.9, normal blood pressure, but his grip strength was 22 kgs, which was significantly low for his age and the sex. It was quite less, and I have mentioned something called as he was a right-handed person. So he was a dominant right-handed person, and the left hand is basically the relative hand grip, what we see. So right hand strength is telling most about the functional activity or the functional strength of that person because he was right-handed. Majority of the work is done by the right hand with his daily activities of writing, eating, lifting objects. So it is telling overall about the functional grip of that patient. And when we check for his left, usually it is low, and it is telling about the relative strength of that person. Yeah, I have 2 minutes, good enough. So it is telling about the relative health, hand grip strength. So if the body's mass is huge or the body size is big, it may give us the false reading. So to that, we call that something called as absolute hand grip strength, which can be divided by his own BMI. We get a rough estimated number, and which could be a better predictor, and we can give us the average of his original hand grip strength. So in fact, there were some studies which suggested that this left-handed or relative hand grip strength could be a better predictor for the outcome of metabolic, how the poor metabolic health of a person, cardiovascular or cardiometabolic diseases of a person can tell. So the relative hand grip strength could be much better marker here. So going further with my case, here he was quite low. Again, we intervened him, we gave him some exercises, nutritional counseling, some more training to him, some protein intakes was given, and it was monitored. He increased by 25 by 22 at the end of 6 months. Of course, though low, but it was bit improved here. The best part that the grip strength identified risk earlier than the laboratory test because his sugars were again normal. Of course, lot of things he did, but it was an early identifier for our patient which could evaluate his metabolic outcome. So future directions, if I say, It could be integrated in our AI because it's all about AI, and we can allow our patients to check this even at their home and they can monitor it very well. Personalized intervention, as we mentioned, we can give a personalized nutritional counseling exercises to this patient for a better outcome. So four key remember things if I have to mention from the take home messages, that our grip is our survival, then strength is about reliable, and the strength is reliable than our size, the bulk which I was talking. So it is reliable, it is very simple, it is very scalable, and we should all opt for this as a fifth vital sign of metabolic health. So dear friends, if I have to say, the future of metabolic health is not just about the numbers or the lab reports what we see. It could be the fifth metabolic vital sign, which is a hand grip test. And from tomorrow, let's inculcate, because it took time for me also to integrate in my practice. From tomorrow, we can go further. Rather than just taking the lab reports, we can go for the blood pressure, and the fifth one could be our hand grip here. And next time, whenever you handshake with someone, it can tell you more about the metabolic parameter. It's a window to your metabolic health for the patient. So that's all from my end. Thank you so much.